we administered anesthesia with an injection. After that, we provided oxygen through a mask to support breathing. Once the patient was stable, we prepared for the procedure. After giving anesthesia through injection and providing oxygen with a mask, we proceeded with intubation. Using a laryngoscope, the vocal cords were visualized and the endotracheal tube was gently inserted into the trachea. Once the tube was in the correct position, the cuff balloon was inflated to secure the airway and prevent any air leakage. Proper placement was then confirmed, and the patient was connected to the breathing circuit. At the end of the procedure, the balloon was deflated and the tube was removed safely. After confirming the correct placement of the endotracheal tube and inflating the cuff balloon, we secured the tube carefully with strapping. This fixation was done to make sure the tube stayed stable throughout the procedure and would not slip out accidentally. Proper strapping not only prevents displacement, but also provides safety and continuous airway support during the surgery. Once the tube was firmly fixed, the patient was kept under close monitoring to ensure smooth ventilation and oxygen delivery. After securing the airway and confirming proper ventilation, we proceeded to address the abscess on the buttock. The area was first cleaned and prepared under aseptic conditions to reduce the risk of contamination. A careful and small incision was then made over the most fluctuant part of the swelling, which immediately allowed pus to escape under pressure. The thick, purulent material was gently expressed until the cavity was adequately decompressed. Following this, the abscess cavity was explored using sterile instruments to break down any loculations and to ensure that all collections of pus were completely evacuated. This step was important to prevent recurrence and to promote proper healing. After full drainage, the cavity was thoroughly irrigated with an antiseptic solution to flush out residual debris and reduce the bacterial load. Once the cleaning and irrigation were completed, we applied a sterile dressing over the incision site. The dressing served both to protect the wound from external contamination and to absorb any further discharge. The patient's condition was observed closely, and clear instructions were given regarding wound care and follow-up.